Obviously, we're thinking about exercise today. We're thinking about why we need to exercise, but it was trying to establish a better understanding of what exercise is actually in the first place. So, when we talk about exercise, we know that this is essentially any activity, physical activity that helps you to increase your heart rate, improve or maintain your fitness. Now, we'll go into the kind of detail of it later on, but we all have opportunities to exercise day to day. And the big thing that often happens from childhood to adulthood is that we feel and we don't naturally do these things in terms of exercise. So, of course, our fitness goes down. But we know that for almost everyone, exercise is the best medicine to treat multiple conditions, to make you feel better, for your well-being, for your strength, and something that actually is a very low-cost activity, even a free activity that pretty much anyone can do. So what I really want to encourage us all to think about and do today, um, with regards to exercise, the keys, finding something that you enjoy doing. Okay. If you know when you're in school or different settings, you may have been forced to do certain exercises, but in later life, the one that you're going to continue is the probably the one that you enjoy. So that's really important. Start slowly and then gradually increase. No one's asking anyone if you've never run or done anything to run a marathon tomorrow. It's about starting slow and then gradually increasing and seeing what your body's capable of achieving and doing. And then the final thing, consistency is the key. We hear this about lots of different areas of our lives, but the first day is the hardest, and the second day, third day, fourth day. And if you can be consistent, even if it's with a small amount of exercise, that can be key to being making a lifestyle change and becoming used to exercise as well. So what should we do? There's a lot of information out there in terms of what people can do, what people shouldn't do. But we know a big place to start for most of us is to move around more, whether that's in the house, or when you're at work outside, and sit less than we do. Almost in pretty much most societies, most countries these days, we all sit down a lot more than people used to do 40, 50 years ago. And that is, of course, playing a part in our reduced physical fitness, our deconditioning, having issues with joints, especially back pain. Okay. So we think about trying to generally think of opportunities to move more and at least trying to sit down less. Now, the guidelines that international guidelines generally say that we should try to do 150 minutes of what we call moderate exercise each week. Now, the 150 minutes, it doesn't necessarily have to all be in one day. And actually, for most of us, the most practical thing would be to spread it out over different days. So that's a great place to start thinking about doing some moderate exercise. We say moderate because it's about how your body feels when you're doing it. So you should feel a bit warm doing it, your heart rate's going up a bit, but you should still be able to talk and have a conversation and feel comfortable doing that. The other option that some people recommend is doing 75 minutes of more vigorous exercise. Of course, you can mix and match the two, but vigorous exercise obviously feels more strenuous. You'll be sweating probably. It'll be harder to talk in full sentences because of the intensity of your exercise. Now, I think a key thing with all these kind of ideas is that actually with any of this activity, you don't have to do it all at the same time. You can spread it out. You can fit it around your day-to-day life and what you need to do. And remember, it doesn't have to be in a gym. It doesn't have to be like a competitive kind of environment. This can be you self-directing activity to try to move more, sit less, and increase your heart rate, which is essentially the aim. So just some simple examples, even things like doing like housework, some of the housework that's more vigorous, like say gardening or even vacuuming the place. That generally for most people increases your heart rate. It gets you feeling a bit warm, especially if you're having to lift things as well. That can be part of your moderate exercise. But as I said, it's being consistent with whatever activity that you're doing of your choice. Now, we always think about intensity of exercise. I've put this up just to show you that the sedentary is one side of the spectrum and very vigorous is the other side. Even if from today, what you take is moving from sedentary to doing more light exercise, that's great. If it's moving to doing moderate or vigorous, that's great. It's about trying to gradually increase whatever you're doing exercise wise for, as I said, for your well-being, for your physical condition, and being consistent with it. Now, not all of us have the opportunities to have structure in terms of playing for a team or anything like that, but I'm just trying to show you that there are lots of different opportunities and lots of things that you can adapt to try to fit it in your day-to-day life. So even the moderate exercise, you can see that talks about walking, going up and down stairs, gentle cycling. Obviously, there are things in the house that you can do that involve some movement. And what I'd always encourage people, when I said about kind of increasing your heart rate, often I'll see my patients in clinic and I'll say, okay, so talk me through what exercise you do. And they'll say, oh, I walk, I do a lot of walking. But when I see some of these people walk, the walking pace is very slow. So when we're walking, even if it's just trying to do a brisk walk for 10 minutes of whatever walking you're doing, that is exercise. And that is going to be helpful for some of the chronic conditions that I'm going to talk about later on that often happen, in your late 30s, in your 40s, and as you get older. So I really want you to take away the thought of what can I shift in my lifestyle, in my pattern, even to move from the sedentary side of things towards the more vigorous exercise without it costing too much, without it being too dramatic and intrusive in your daily life. So, opportunities for exercise. Now, this is really what I want you to, even like when you go later today, write it down on a piece of paper. Because I think when we think of exercise, we can break it down into these different areas. So, as I said, work. Many of us these days, as I said, work at a desk or work sitting down, or even those of us that work standing up all day, that can have its own issues as well. But what I want to encourage you to do, if you're especially doing a desk job, try to get up every hour. 5 minutes to do some stretches, to walk around the room you're in, even if you have the opportunity to walk to see a colleague and walk back, so that you're not in that seated position all day, which we know is bad for the back, bad for the hip, and can make your neck feel very tight and your shoulders feel tight because you're hunched over on a computer or in an uncomfortable chair. Also, with work, we think about having a more active commute. Now, depending on where you live around the world or in London, wherever it is, we had there are different options in terms of commuting. Some places there's good infrastructure with trains, buses, or even, these hire bikes that are becoming more popular. But for some of us, we're in a car a lot these days. And sometimes you're stuck in a lot of traffic sitting there. So, that's a thing that you need to think about. Are there things I can change with my commute that can incorporate exercise just in my commute? Something that we talk about a lot, at least in the UK, is if rather than getting the bus right to your work, getting off one stop before. So you have to do a bit of a walk at the end. This is, of course, if time allows. Or, these hire bikes that they have around in some countries, using them sometimes to use in your commute. But just thinking about in your work setting, what opportunities do you have? And almost later this evening, as I said, write down work, lifestyle planned and jot down a few ideas that you can start doing in the next week, the next month, and almost marking yourself, what have I done to build up the consistency of all these things? And lifestyle wise, again, I've more mentioned about walking rather than driving. And I think for those of you with families, lifestyle is very much a thing that you can get your whole family involved in, especially if you've got younger kids or if you've even got older parents. Making the lifestyle environment in your home one where you try to walk as much as possible. You say, okay, let's go out for a walk. Now, I know many of you will be in countries where the weather's not as bad as it is here in London. So that's the thing that often puts people off as we come to winter in London. But especially in countries where the weather's nicer most of the year, the evenings are bright. These are opportunities as a family in terms of your lifestyle to start saying, okay, every Saturday we go for a family walk, or I take my kids out to the park and I walk around whilst they're playing. I take my elderly parents out and we do a little walk outside. So these things can be really helpful. I've mentioned about increasing your walking pace, but also think about Opportunities to use the stairs or walk up escalators rather than using a lift all the time or just standing still on the escalator. Now, if you haven't walked upstairs in a long time, it's going to feel tiring and that's normal. But as you do that over time, you'll get to realize that your body is actually getting used to that bit of exercise and you feel a lot more comfortable walking up the stairs. And of course, my next challenge for you after walking up the stairs is doing a faster walk up the stairs, almost jogging up the stairs, because that's what happens when you do an activity and you keep practicing, you're consistent, you will gradually feel a lot more comfortable doing it. I've also mentioned about the brisk walking. So that's the planned activity. So of course it can be um, the brisk walking that I mentioned, just going out to do that. But there's also obviously more structured exercise that we think about in terms of aerobic exercise, which is what gets your heart rate up, flexibility and strengthening. And Fernando later on is going to go into more detail about the different aspects of that and what that can look like in your day-to-day life as well. So please write down this evening, work, lifestyle planned, and jot down some ideas about the different things that you can do in all of these spaces. So, why do we need to exercise? I've mentioned, obviously, in my GP work that I talk to patients a lot about this. Now, a lot of people feel that us doctors, we love giving medication. I personally do not. That people that will come to me and say, I've got this problem, what medication can you give me? And then I want to start talking about exercise, and they feel a bit disappointed because they just wanted the medication. But actually, thinking about the benefit of exercise and physical activity, the main driver for it is because it can help with so many medical conditions. We know the research shows that things like the rates of diabetes, the rates of heart attack, stroke, the rates of falling or having chronic back pain dramatically decreases in people that regularly exercise. And then we've become more aware in recent years about the general benefit in terms of your mental health, well-being, managing stress as well, just how you feel because of exercise. And especially with our busy lives these days, what I was saying about making it a family lifestyle change is so important because we know even the thing of, as I said, going out for a walk once a week with family, that can be something that improves general family quality of life, spending time together and overall improving your well-being. So the key thing is that some exercise is good if you can increase, even better. And every minute counts. Anything you can do from that kind of workplace, your lifestyle or structured exercise, all of this counts together to try to have the benefit of exercise in your physical health for actual health conditions and also in your general well-being too. So this is kind of a summary, and it's something that you can easily find on the internet. And if it's something wanting to print out, put somewhere so it reminds you. But the big thing here is all about the 150 minutes of moderate exercise or 75 minutes of more vigorous. And we know that obviously for some people you'll do a bit of both, which is absolutely fine as well. And then the key thing that you can see in the bottom left-hand corner is about minimizing sedentary time. These days, and I know I'm sometimes guilty of it at work, a lot of us have those chairs with wheels on. And sometimes I tell myself off, rather than walking, I'll almost be sliding my chair across the office to go and get something. And I think you need to get up. You've been sitting down for too long. You need to get up. So just trying to think of opportunities of minimizing the amount of sitting. And as I said, if you're working, getting up, doing a little stretch, at my work, we have posters on the wall reminding you how to do chair-based kind of yoga and neck exercises and stretches. And that's such a good visual reminder. So as I said, if this screen I've got up is really easily available on the internet, but even if for yourself, writing a little reminder where you sit or work to get up every hour, or set an alarm on your phone every hour that goes off to remind you to do that. So the reason I show this graph, this was a great piece of research that was done some time ago, and it's basically telling us that moving from that sedentary point, so you remember the left-hand side of that chart I showed from sedentary to very vigorous, moving from that to even doing the 150 minutes, your benefit is greatest in that space. So doing a little helps, doing more helps, and getting to that 150 minutes, you can see the curve is steepest at that point, which shows that the health and fitness benefits just by doing that little bit extra is the greatest. Of course, it plateaus out as you do more and more, and this is kind of towards the other end of the scale. That's kind of thinking about the more elite athletes who are training, intensely 5, 6 times a week. And of course, yes, they can be more likely to get injured. But as you can see from the graph, the risk and harm at that sedentary to 150 mark is incredibly low, which is why I mentioned at the beginning that for pretty much everyone, exercise is the best medicine. And it's pretty much no one is advised not to exercise at all. So just kind of remember that in your mind when you start, that even if you feel you're not doing much, there's that incremental benefit, even just doing, say, 60 minutes of exercise or doing 100 minutes of exercise spread out a week. So don't be put off if you feel you can't do like too much through the week. This is what the evidence shows, and this is to really encourage you as well. So, and again, this is again showing that information in another way. Obviously, with exercise and society these days, and I guess pushed by doctors as well, we often talk about weight management as well. And exercise, of course, can be helpful for that. There's no doubt about it. But I do always tell people that come to me and say, Doctor, I've been exercising, going to the gym 3 times a week, etc., and I'm still not losing weight. Number one, we know that exercise has so many benefits apart from weight loss. That's a side product. As I said from that chart, there are benefits for heart disease, for stroke, for different cancers, and there are all these other benefits in terms of quality of life, strength, just general fitness, separate to weight, so that you feel better to do daily tasks. Again, weight loss is something slightly different. And obviously there's a whole lots of things that interplay in that. But we know that at least doing exercise is able to help with weight maintenance. And we know for weight loss, often, yes, you do need to do higher intensity exercise. But again, do not be put off. If you do increase your exercise levels in the next weeks to months following this talk, and you're not finding that your weight is disappearing, please be reassured that there are so many other benefits apart from just weight loss, because of apart from just focusing on weight loss with exercise. So do persist, even if you feel you're a bit put off. And ultimately, this bit about strength, we know that you get more muscle when you exercise, which obviously is going to add to your weight, or kind of mean that your weight doesn't drop off. And we know how important strength is. So that can be part of the reason why people don't lose lots of weight, even if they are increasing the amount of exercise that they're doing. So I'm just going to touch on a few things. Obviously, menopause, again, is another life stage that can sometimes cause issues in terms of how women feel and ability to exercise, etc. So we know that the symptoms of menopause are really broad and can be quite debilitating for some people. So I've just listed a few there in terms of the fatigue, muscle aches, weight gain, which I was mentioning now, mood, urinary symptoms and things. Now, at the time of menopause, obviously that's typically kind of 48, 50 years old in women. Sometimes that because of these symptoms, women can stop exercising, especially if they were before. And what I would say to this is that at the time of the menopause, that is certainly the time to try to avoid stopping, because we know that exercise is listed as one of the great treatments to manage some of these symptoms of menopause. It can sound confusing or counterintuitive because you're fatigued, but someone's telling you to exercise. But we know that the body fatigue actually reduces significantly with exercise. The muscle aches get a lot better if you're following a strengthening program. As I said, that will be discussed in more detail later. And we know the mood can be addressed because of the benefits, because of the hormones and things released when you do exercise. So my message in terms of around menopause, obviously, if you're doing exercise already, make sure it's not something that causes you to stop. Think of continuing exercise as a treatment. And if you've never started before, or never done exercise, menopause can be a great time to start going for that 10-minute brisk walk that I was talking about, which is a great starting point, and then building up from there. And you can see, should be able to feel benefits if you're consistent and if you find other things that you're really excited and able to do. And specifically for women as well, we know that kind of even from your mid 30s, your bone density, so that's like related to almost like how strong your bones are, starts to fall and falls a lot faster once you hit menopause and your estrogen basically goes. So that's why we always talk about trying to maintain activity and increase activity, and especially weight-bearing activities. So when your feet are in contact with the surface, because that can really help maintain and even improve your bone density, especially around menopause, where it does can drop significantly with the estrogen. And then, not to leave men out, there's also the thing that we've heard more recently about the andropause. Now, it's kind of people say it's like the male menopause. They are quite different or a bit different in the sense that menopause, the estrogen levels drop quite dramatically at that 48, 50. Whereas we know that for men, the testosterone actually starts to fall from your mid 30s. So it's not something I want people to get worried about. Oh, I need to check what my testosterone or even start taking testosterone pills. No, that's not what the message is. It's having the awareness that these are some of the symptoms that can happen linked to the andropause. And the way, again, that evidence has shown in terms of managing it is thinking about exercise. Now, the fat distribution thing is sometimes what men notice that they start gaining a lot of chest fat and what we call kind of gynecomastia, where they almost develop like male breasts almost because of the fat redistribution. And that's why we encourage thinking about the cardio, thinking about the strengthening, so that you're burning the excess, almost the excess fat, and being able to maintain kind of your muscle strength and also your bone density as well, because through exercise and remaining active. And, as I said, there's some overlapping symptoms. I mentioned mood again. That can happen in this kind of andropause phase. And again, we know the benefit of doing exercise to try to address this and to improve your general well-being. Um, we also know I don't know any kind of medical conditions that people have, but typically as you approach 40 and above, some of these diagnoses are more likely to have happened or may be coming in the future. So things like osteoarthritis, especially knee and hip osteoarthritis. Of course, these conditions can be very uncomfortable, cause a lot of pain. But even for these conditions, we know that there's a benefit for exercise. But of course, there are things that maybe you need to think about a bit more. Say you've got very bad or uncomfortable knee osteoarthritis. Strengthening is still incredibly important for your leg muscles, for your hip muscles. But think about modifications. So I often tell people, if you're trying to strengthen, there are ways you can strengthen your hip and knee without pounding or doing squats with heavy weights at the gym or pounding the pavements running outside, because that can actually be quite triggering. Simple things that you can do. You've seen in shops, they're very cheap, those elastic exercise bands that you can get from different shops or outlets. Using those as some kind of resistance, putting it around your ankles and doing exercises so that your knees aren't loaded, but you're still getting the benefits of strengthening. Activities like being in the water or swimming, if that's something that you enjoy or can do, again, that's not a weight-bearing exercise, but it's great cardio, great for your strength, great for your mobility as well. Osteoporosis, typically more common in women. And as I mentioned, with the drop of estrogen around the menopause, women can be at higher risks of fractures because of osteoporosis. But again, there are exercises that you can do to kind of help that. And that's more of the weight-bearing exercises that I mentioned. So trying to make sure brisk walking where possible is increased and avoiding activities where there's a risk of falling. So avoiding activities where perhaps like contact activities or things that require a lot of balance that maybe that's not supervised because the bones can be more brittle and you can be more prone to fractures. Back pain. Now, back pain is such a common thing in our society. I think driven by the fact we all sit a lot and sit too much. But with back pain, there's still exercises that you can do. So again, it's not probably not about lifting weights or very heavy weights. Um, if you are going to do that, obviously, I would certainly recommend supervision in the gym or wherever to make sure your technique is good. But really focusing on flexibility and strengthening of your lower back. And if you're doing any floor-based exercises, thinking about a support under your back. So you're not arching your lower back, called the lumbar spine, with your movements and making sure it's supported and you're doing controlled movements to avoid exacerbating your back pain. Diabetes is another condition. We know that over 40, more and more people are getting diagnosed with diabetes, and some even in their 30s or late 30s. There are absolutely there's no reason why someone should not exercise just because they have diabetes. We know again, exercise is incredibly effective for improving your blood sugars and improving your body's sensitivity to insulin that's in your body naturally. So that means that hopefully you won't need to later have to inject yourself with insulin. However, we know that with certain medications, especially insulin, but some of the oral medications, it can drop your blood sugar. So that's why modification for anyone with diabetes mainly would be about making sure that you're having a carbohydrate-rich snack like an hour or so before going to exercise, checking your sugars to make sure that you're not like having a hypo, so that's typically below 4. And equally, making sure that your sugars aren't too high before you're starting to exercise, because both of these can cause problems during exercise. And of course, with diabetes, it's important to make sure you're recovering well after exercise, because with exercise, you're using kind of the carbohydrate and sugars in your body. So making sure you're recovering well after by having snacks that will release energy over a long time. So that's often why they talk about kind of like pasta or thinking about protein for muscle recovery, but foods that release carbohydrates slowly over time and not just kind of having sweets, which just spike your sugar. So those are certainly things that to bear in mind. And obviously, I'd encourage you to speak with a doctor if needed, specifically about your kind of regime and anything you specifically need to be take care about. Cardiac disease. Now, I hear again, a lot of my patients have had whatever heart problem and say, oh, so now I'm just really being careful not to do anything, not to move because I don't want anything to happen to my heart. And I kind of say, something's already happened to your heart. This is a time that we need to start thinking about how to increase your activity and exercise so something else doesn't happen to your heart. We know even after someone's had a heart attack, obviously there's a time in hospital, depending on the healthcare setting you're in, often there's something called cardiac rehabilitation. And the mainstay of this is thinking about, okay, we need to get the heart used to working again in a controlled, in a safe manner. Because actually, those first 4 to 6 weeks after having a heart attack, if you can start getting the heart used to exercising again, there's a lot of new vessel formation in terms of the improving the blood flow to and around the heart. And that's a key window for kind of getting almost your fitness back in a way. So it's, of course, after a heart attack, not about going to start running 10K, 5K marathon. It's about gradually building up the exercise, but certainly not saying that you cannot do anything at all because you've had a heart attack or any other heart condition. And under cardiac disease, I'll also mention about high blood pressure. Again, high blood pressure. I tell my patients, look, okay, fine, we've diagnosed high blood pressure. Let's have a talk about your lifestyle, your diet, etc. They have a debate with me. Maybe they don't want to go on medications. That's fine. But I do say even if you do stop medication, that does not mean that I'm saying you don't need to do these other lifestyle things. Because I want you, fine, you're taking one medication, but I don't want you to end up like some of my patients who are on 4 medications to manage this blood pressure. So certainly, you can do exercise even if you have high blood pressure. But I guess the main modification is making sure that you check your blood pressure regularly, maybe once a week. Check it before and after exercise. Work out for yourself what time of day seems best to take your medication and what time of day seems best to exercise in relation to your blood pressure. So those are things to think about under different conditions. Similarly, thinking about lung conditions, so things like asthma or something called COPD, which is more linked to people who've smoked in the past. Again, I have both kids and adults will come to me and say, I'll try to ask my exercise. Oh, I can't do any exercise because I've got asthma. And I say, okay, what happens when you exercise? Oh, I get very tight in my chest, get very wheezy. And I say, that is not a sign that you can't exercise, but it is a sign that your asthma is not well controlled at the moment. Because we know as well for the lungs, exercising almost trains the lungs to be able to react to triggers or stress triggers. Yes, exercise can trigger what we call like an asthma attack or the wheezing and things. But what we do know is that in the long term, the benefit of exercising far outweighs any kind of perceived risk of exercising. And actually, for some of these people, the key thing is optimizing their medication so that they can exercise. And we know a lot of high performing athletes have asthma. So, it's certainly not a reason not to do any exercise because you have a lung or chest condition. Now, with all these things, I'm kind of giving broad kind of modifications. Of course, we'll have a time for questions, but if there are kind of specific concerns about your health or your specific condition, obviously the recommendation is to speak to kind of a medical professional to get specific advice because, there are different medications that people may be taking. When to stop? Now, I think obviously I've talked a lot about exercise. That, as I said, there are very few people who should not exercise or who should reduce the amount of exercise that they should do. However, there's still things that we must be aware of to know that this means I need to stop. I need to stop exercising. So if you get chest pain during exercise, that is a sign that you must stop. And by chest pain, I mean like a sharp pain related to exerting yourself, the pressure, heaviness on your chest, that's a sign. Now, part of the reason I say when you do start exercising, you need to do it gradually is so that you know what your body feels like and what's normal for when you exercise. Muscle ache, feeling like you're breathing heavily or uncomfortable in your chest, that can all be associated with exercise and it can be quite normal. But it's trying to understand what your body feels like at lower levels and gradually increasing it so your body is adapting as you exercise. But chest pain is different to your body feeling a bit uncomfortable whilst you're exercising. And similarly, if you get any dizziness or feeling very lightheaded, check what's going on. That could be linked to maybe you didn't eat enough and you're diabetic, so your sugars are low, but it could be related to something going on in your heart. But it's certainly something that should make you think, let me stop what I'm doing, check my sugar, or let me stop what I'm doing and get checked out to know that this isn't something that's a problem. Palpitation, so that can be the sensation that your heart's beating very fast in your chest or irregularly. And again, your heart beating fast isn't necessarily a palpitation. It's something normal that should happen with exercise. So that comes with the part about knowing what normal exercise should feel. Typically, it can feel almost like your heart is beating out of your chest or even beating irregularly when you've exerted yourself. So that is another sign that you must stop exercising. And I also say excessive shortness of breath. So you know what's normal for you as you exercise and how you recover. But if you're, feeling excessively short of breath for a certain exercise, that again is a sign that you should stop, get checked by a doctor. If it's that serious, especially a chest pain presentation, obviously hospital. And then, of course, you can restart at a lower intensity or lower frequency to make sure that your body's responding well to exercise. Okay, so that's the end of my kind of core presentation. So thank you for listening. I think I'm going to hand back to Flora in case there are any questions, and we can then take it from there.
Fabulous. Thank you so much. Can we show some appreciation for Dr. Chinyere, please? Use your emojis. Do we have any questions? I can't see any questions in the chat at the moment. If you have a question, you can raise your virtual hand or pop it in the chat. We'll give 1 or 2 minutes for that before we move on if there are no questions. So just raise your virtual hand if you have a question. Thank you. Yes, thank you. We have some people showing appreciation in the chat. Very informative. Yes, it was. And it was up. Great. So no questions yet. Okay, that's fine. Perhaps later on, by the time our second speaker is done, we'll have more questions. Thank you so much, Junior. So they'll give you a break for now. So we are going to go straight to our second speaker for today. Let me just introduce him with his bio. We have Fernando Jahini. He is a physiotherapist and a senior musculoskeletal specialist, and is the founder of Rehab Solux Physiotherapy Clinic. His special interest is exercising with chronic pain and physical activity in midlife. Over to you, Fernando.
Okay, thank you very much, Flora, for this lovely introduction. Thank you, everyone, for joining us today as we explore one of the most powerful interventions for healthy aging, which is exercise. So I will just put my slides up. Share.
It's come up, we can see it.
Okay. Right. Okay. The idea that exercise is essential for health is not new. In fact, its roots stretch way back to ancient Greeks. Around 400 BC, a scientist called Hippocrates, he's a philosopher. He's widely regarded as the father of modern medicine. He observed the crucial link between lifestyle and health. So he famously proposed that eating alone will not keep a man well. He must take a regular physical activity. So he made a simple but yet powerful observation, which kind of resumed in this quotation, I quote, all part of the body, all part of the body which have a function, if used in moderation and exercise in labor in which each is accustomed, become thereby healthy, well-developed, and age more slowly. But if unused and left idle, they become liable to disease, defective, and grow and age very quickly. He then, with his colleague, noted that walking is also a natural way of exercising. So he actually started introducing walking into his patients' routines. So that's a little bit of history about how exercise come about. So with his observation, because it's not well documented and also is not bound by modern data, we got early observation that came from London, England. So that came from Professor Dr. Jerry Morris, that's so basically 100th century after that, this wisdom has passed down, but a lack of robust data mean that exercise is not usually used for as a part of treatment. Now, Dr. Jerry conduct his observation on London buses. So basically, what he studies about is to study group of workers for London transport, namely the bus driver who sit down all day, and also the bus conductors, which walk up and down the stairs, asking for ticket fare and the rest. So this observation actually realized that the conductors had less, almost half of cardiovascular disease compared to their counterpart, the drivers. reason for that, the drivers kind of live a sedentary life. So my colleague has spoke long about keeping active. So this is quite crucial. So these findings were compelling, and the physical activity conducted experienced approximately half of the heart attack, sudden death compared to the sedentary drivers. So this was one of the first non-formal epidemiological study to provide strong empirical evidence that regular physical activity could significantly reduce the risk of cardiovascular and coronary death. To bridge the gap between movement and exercise, let's look at some definition. So, defining movement and exercise, how they relate. Movement, a bodily motion increasing energy expenditure. So basically, you sit down, you move in, you get up, you walk. So you're spending energy. Unlike exercise, exercise is a planned, structured, repetitive activity to enhance fitness. So what's the link between, what do we know? What's the link between movement and exercise? So movement maintain daily function while exercise restore physical capacity. Main type of exercise modality and the jargon busters, because obviously online we see all these advice about exercise. You only need one exercise to heal your pain, or you need cardio, you need strength, you don't need yoga, you don't need all this. So the advice is quite confusing. So there are general categories. So the advice is quite confusing, sorry. So main type of exercise modality are grouped in categories. So the main type are exercise aerobic training. So aerobic training basically just means that you're doing your endurance training, your cardiovascular exercise, continuous training, aerobic, rhythmic exercises, which basically help you to raise your heart. So second, muscle strengthening or resistance training. This is basically a training that uses either body weight or free weight to load different parts of the body. A strength training, weightlifting, aerobic calisthenic, body weight exercise. It's all part of the muscle strengthening. Flexibility training, pardon. Flexibility training requires us to stretch our joints and to increase range of motion, exercise mobility, exercise limbering. So all that to do with joint and flexibility. Balance training, very crucial, especially for people in midlife, because obviously we're getting a lot of issue when you hit midlife. The first one, you got low mineral bone density. So if you haven't got balance, you have high risk of falling, and if you fall, you now break anything in your body, and that is going to set you back. So balance training is quite crucial for that. So now these are just examples of exercise modality, just to sort of focus on everyone knowing exactly what they meant. So cardiovascular exercise training, for instance, example will be cycling, jogging, light jogging, swimming, air climbing, kettlebell swing, rope jumping, rowing machine, burpees, hiking. So all that are some kind of example of cardio exercises, followed by resistance training. Anything to do with body weights, free weights, gym equipment, the resistance band, anything that help you to load your body is actually referred to as strength training. Balance training. Balance training is a type of exercise that actually connects our brain to every part of our body. So we call something proprioception, which basically means your limb finding themselves in space. So basically, balance training help with that. So what's the reason why we do balance train, especially in midlife? It's quite important to do that to sort of prevent fall. Like I said previously, fall is a high risk incident for people in that sort of age because they experience already low mineral bone density, sarcopenia, which is loss of muscle. So when you fall, there's no padding, you break something, and that's going to send you back. Okay. Next exercise is flexibility, and obviously it's called stretch training. Flexibility is quite important for people in midlife because obviously that's where you start experiencing a lot of stiffness in your joints, reduced range of motion, and difficulty with mobility. So strength training is very important to help to sort of overcome those issues. Okay. Now, how do I know what type of exercise to do? Information overload masters. So if you just need to sort of go online, you will find so much exercise, so much adverts asking you to do this particular type of exercise or to do this, just this only one exercise will help with your blood pressure, will help with your weight loss and all the rest. But how do you know what type of exercise to select to go for? Choosing regular exercise, physical activity, and exercise program, it's very crucial. So the research actually said many adults feel overwhelmed with conflicting exercise advice online. Around 70 to 75% report needed help to choose appropriate exercise. Confusion reduces confidence and poor adherence, because if you're confused about what type of exercise to do and you happen to select exercise that you don't really like, and then you stick to you, the chances are you're not going to be able to stick to that for long, and you end up giving up. And that is a poor adherence. Now, how do I go about choosing exercise? Choosing a regular exercise or exercise program is quite important, but you need to know your option. Choose from maybe the walking. So we talked about the option previously: walking, cycling, strength training, yoga, Pilates, swimming, or variety of other sporting activity that you enjoy doing, because the key is the enjoyment, because consistency is more important than intensity. So you have to enjoy what you do to be able to be consistent and gain the result. So main exercise tab with primary health benefits. So this table is designed to help you to kind of do an informed selection of exercise. So type of exercise, you got aerobic or cardiovascular exercise. So definition is on the second column. After that, the physiological focus. So basically aerobic focus on cardiovascular and endurance, respiratory efficiency. And an example of that would be cycling, walking, swimming, and the health benefits is good heart health, good lung function, good metabolics, and cognitive health. So we got resistance training. Resistance training exercise involve external load, or you can use your own body weight to create muscle contraction. And what does that do physiologically to your body? It gives you muscle strength, bone mineral density, and muscle mass. Example of that would be weight training, resistance band training. Benefit will be counter of sarcopenia, even osteopenia, sarcopenia, osteopenia, or even weak muscle. And the evidence is all there as a reference. Now, I'm just going to leave you to sort of have a look at that table later on, because it's so repetitive. And then we're moving on to how much exercise or physical activity do I need to do? Dr. Chi has touched a little bit on this. However, I'm just going to quickly brief you on the optimal effect of exercise. So basically, I would just be saying to you, focus on your goal. By focusing on your goal for optimized benefits as an adult. So vigorous exercise, for instance, is between, sorry, let me go back. 1 second. So how much exercise or physical activity do I need to do? Not too little, not too much, just the right amount. So that's basically that's what it is all boiled down to. Not too much, not too little, just the right amount. And what consists the right amount? If you exercise it with moderate intensity, and that's exactly the right amount for you to gain the optimal health benefit as an adult or as an exercise enthusiast. Again, progression is key. So you're on optimal range, but you can't just stay there, because if you stay there, you're going to start regressing. So you need to keep challenging your body by progressing those exercises. We'll talk about progression of exercise in a minute. Now, again, this table kind of tells you a little bit about how hard you're working, and that also Dr. Chin has spoke to a little bit about this. I'll put it in forms of table and use most of, I kind of related to singing and talking for people to be able to relate to this. So light exercise, or let's start with moderate. So if I'm exercising a moderate intensity, basically that means I can still carry out a conversation but not be able to sing. So if I reach the vigorous stage of my exercise, then there will be no more singing, no more talking. I'm actually gasping for breath, and that's going to be difficult to hold a conversation. So if you rate yourself in this way, you should be able to tell how hard or how light you're working. And that's something which is quite important, because you can only progress if you know how light or how hard you're working. So if you're working very light, you need to sort of progress to the next level. So this table kind of tells you a bit of exercise, physical activity, and exercise recommendation. Dr. Chin has already spoke to us about this, so I'm not going to go into too much detail with that. Again, we talk about 150 minutes for cardiovascular training, and then for muscle strength training, you need at least 2 days in a week. Balance and flexibility need to be done every day, basically. This is a typical home exercise program structure. So you have the modality, which is the type of exercise that should be included in your program. And you have the frequency of doing that exercise, which is 2 to 3 times a week for resistance, aerobic 3 times a week, and balance core will be 3 times, flexibility and mobility will be daily. Intensity. Now, you can notice that in here, we kind of refer to the intensity as 6 to 80%, 1 repetition maximum, which is 1 RM. Now, you might not necessarily want to use this intensity gauge, reason why we spoke previously about rate of exertion. So this can be also used for that. So if this works better for you, use this instead of 1 rep max, which is a little bit more technical. And duration is here, progression strategy. So obviously when you're exercising, you need to progress, because if you don't progress, you become stagnant and nothing happens. Your muscle will start regressing, and everything that you achieve, you find a regression. So it will take basically a week for the muscle to start losing a mass. So progression is key to ensure continuity and good health. Now, sustainability, progression, and adaptation. I just spoke about progression, so we now here. Sustainability, adaptation, and progression overload are core principle and core principle for designing exercise for effective workout. Sustainability refers to creating a routine that is realistic, enjoy, and can be maintained consistently over a long period of time. Adaptation. So adaptation is the body way or the body physiological response to the stress placed upon it during exercise. So if you overload yourself with, if you start exercising with 1 kilogram weight, for instance, during the next 3 to 4 weeks, your body will get used to that. And that will become very, very easy, and you're not going to feel any more benefit. So obviously, you need to go to progressive overload, which is incremental loading, so gradual implementation of that load. So this is a fundamental principle for consistently increasing the demand on the body to ensure continuous adaptation and prevent performance plateau. So performance plateau basically means that when you get to a point, an optimum point, and if you're not consistently challenging yourself, you're going to remain stagnant and your development will stop. Recovery. So during your exercise program, you need to make sure you include recovery time, because that is crucial for the muscle health. Because if you exercise it, especially with heavy load, the chances are you're going to hurt yourself. And that's how the muscle grow bigger anyway. So you have more macro tear, and they do need some time to recover to sort of get back to their strength. That's how they get bigger and stronger. Can I exercise with chronic health condition and pain? It's a tricky one. The simple answer is yes, but before I say yes, please have a look at the disclaimer alert. Before you engage in any physical activity, consult with your healthcare professional for professional advice and plan. But yeah, overall, many people with chronic health condition and chronic pain should be able to exercise with no replication on their condition, rather improve their condition. So chronic pain involves centralized sensitization and fear of avoidance. So that's the core concept of chronic pain. So the goal here for the chronic pain sufferers is to exercise within limit of that pain. So exercising in this case is not to eliminate pain entirely before moving on, but to safely reintroduce movement to break down the cycle of fear, the conditioning, and decrease sensitivity. So we want to tackle that first, and then gradually progress into more physical activity as able, if you're able to sustain the first introductory movement. So by adopting a strategy of start slow, go slow approach, and working within supportive healthcare team, individual with chronic condition and can transform their relationship with exercise and significantly improve their quality of life. This kind of basically mean the most thing that stop people with chronic health condition and pain to engage in any physical activity is mainly the fear of avoidance and the fear of making their issue worse. So the recommendation is graded movement, which has become the cornerstone of the effective chronic pain management. Also, we tend to sort of approach this in a holistic manner because obviously there's a psychological issue with chronic pain, anxiety, depression, and kinesiophobia, which is fear of movement. So we need to sort of approach these people with a lot of holistic emphasis. Reason for engaging in physical activity. Or reason for not to engage. So basically, those reasons are classified in 4 main categories. So, first category is physical, pain and symptom of exasperation, physical fatigue and breathlessness, psychological fear of avoidance, belief of fear of avoidance belief, and also fear of movement, which is the kinesiophobia. Low self-esteem and motivation, lack of knowledge and guidance. That lack of knowledge and guidance kind of fall into the it fall into health literacy in a way, because I mean by that we we are not aware about what's going on in our body. So difficult to sort of get your health information and interpret them and then seek for the appropriate health. So that's one of the key things for most ethnic people that I come across in my clinic. Lack of support and accessibility, convenience, and cost, that falls on the social and environment. Okay. Now, if for any reason you're still reluctant to exercise as an individual that suffer from chronic condition and chronic pain, it means that you're going to kind of lock yourself in that vicious pain cycle. So you start having pain, you rest, your muscle gets stiff, and atrophy kind of starts settling in. Movement is become more difficult and painful, and that means you move less and less. You lose fitness and weaker. You feel fatigue. Movement become more painful, and then pain comes in again. So you keep going around that circle until we break that circle with either pain management. So how do you do that? Again, is a holistic approach treatment for these people that I mentioned earlier. So this cycle needs to be broken somewhere for you to start moving on. And what the research advocated is a graded exercise approach with education advice and a holistic treatment for these people. Now, solutions. Role of exercise support with holistic approach. So basically, we know that with the research that pain exercise kind of increase or induce central hypoalgesia via the secretion of hormone called endorphin and serotonin in our body. So this kind of numb the pain temporarily. So exercise is good to help with that. The best approach, again, like I said previously, is graded approach to the exercise, and also combination with education, advice, pacing, which means that start very low and move gradually, and work with your ability. By adopting the start slow and go slow approach, and working with a supportive healthcare team, individual with chronic pain condition can transform their relationship with exercise and live a happy and fulfilled life. solution continue. Again, we talk about graded exercise therapy. We talk about movement retraining, pacing, mindfulness, and to reduce a fear of movement. Best evidence approach is combination of all those three exercises. Some difficulty and barriers to exercise adherence. So exercise adherence basically is mean that how well you stick to your exercise regime. So what are the difficulty doing so? So we kind of classify them as lifestyle, social and environmental factors. So lifestyle, we talk about, we saw in our modern lifestyle, we complain too much about time. So you're competing with family life and work demands, lack of energy. You come back from work very tired, and the last thing you need is to go on the treadmill and start running. Lack of motivation or willpower, physical or mental health issue, lack of self-efficacy and confidence, incorrect belief, poor health literacy, and again, that come back here, and undiscipline and poor self-management skill. So when you talk about time scale, I probably will refer you back to trying to sort of manage your life. So again, that's where discipline comes into it, self-management comes into it. Social aspect, lack of social support. So many people, especially in midlife, want to try and exercise. However, the lack of, they're a bit timid to sort of start approaching this. So family support is quite crucial to sort of encourage these people to sort of have a first go. And then once they're getting used to it and the motivation is there, and they will eventually stick to it. Negative social influence, family, for instance, and friends, especially in the African community, sometimes women tend to not exercise because obviously the family teasing them, say, well, as a woman, you should not be lifting weight, you should be just get yourself ready for having children and stuff like that. I say no, you need to exercise, especially as a woman, because when you reach the menopause stage, your bone mineral density, so you're gonna have sarcopenia, muscle, loss of muscle, loss of bone mineral density, and all that actually got a good outcome through exercise, especially strength exercises. So environmental and structural issue, lack of facility resources. Yes, I mean, for the environmental structure, lack of resources, I don't necessarily, as a physio, I don't necessarily see that as a barrier, because you do not actually need any equipment to start exercising. So gym or all those fancy equipment, they're good. However, they're not crucial for that purpose. Cost, yes. I mean, if you worry about cost, again, you don't need to go to a gym because obviously gym membership can be very costly, and buying equipment can also be costly. So you can use your body weight and TheraBands, so SS resistance band and all those stuff to just help yourself and exercise without any equipment. Inconvenience, facility being too far. Again, like I said, you do not need any equipment to exercise. So for me, the environmental issue can be a little bit overrated, basically. So I would say walking is one of the best exercise we had. So just start walking, you don't need any equipment to start that. Doctor has actually mentioned that many times. Okay, some strategy to support adherence. Now, let's have a look at that. Adherence is defined as the ability to stick with a particular exercise program. We talked about that previously. To establish routine, so to sustain exercise program to maintain adherence, you need to establish a daily routine. Include exercise into your daily activities. For instance, if you're going to work, so it could be easy to sort of get up. So you're taking the bus, for instance, get up like a 4 or 5 stop ahead of your work and then walk there. So that's basically half an hour of exercise done. And that become part of your routine. So you do that every day of the week when you go to school, to work. And that is something that will stick to you, and then that will improve your adherence. Create a new lasting habit with the concept of flexible adherence. Now, one thing that people find difficult is to try and set a goal and only to notice that they're not able to stick to that goal. So even if you try and set a goal, be flexible about it. Because if you're flexible, you can fall off of the wagon and then come back to it. Don't be too hard on yourself, because if you are rigid in that sense, then you're going to start feeling overwhelmed and possibly give up all your hard work at the end of the day. So be flexible with your shortfall. Set a smart goal. Obviously, it is important to set a goal that is measurable, achievable, and also excuse me for a second. So measurable, achievable. The goal needs to be relevant to you, because if it's not relevant, then you're probably going to lose interest in a few weeks down the line. And that goal needs to be timely, because any goal without time scale is just going to be open road. So you don't know where you start and where you stop. So we need to sort of put time scale to that. So by setting this goal, I think the main thing about setting this goal is to link the goal with your value or even your health. So if the goal is linked to your health, for instance, I've got diabetes, okay, because I want to improve my condition, so this is why I'm doing these exercises. So the goal or the idea of setting goal using something that is very important to you is quite crucial in keeping that goals. Tap into your social support network, family, friend, and also don't forget all these digital gadgets that are available in the market these days are there to help to support your adherence and your progress. So things like the pedometer, for instance, to count your step, so step counts, Apple Watch, just to name a few of those. And also, it is important to celebrate a small win, small successes, to build confidence and consistency. I mean by small wins, so if you're able to walk, if you start walking today for maybe 10 minutes a day, and within the next 2 weeks, you're able to achieve half an hour, that's a big win or small win, however you refer to it, and you need to celebrate that and to keep that motivation going. Ultimately, we're doing all this for for a few reasons. So, reason why we're doing all this exercise and all that, the rest is to optimize our health, function, independence, and also longevity. Regular exercise in midlife is essential, not optional. Combination of resistance, aerobic balance, and flexibility optimize physical, mental, and metabolic health. Health education and progressive overload sustain long-term benefit. So, like I mentioned earlier, to be able to get more benefit out of your exercise regime, you need to sort of follow the progression overload route, which basically means that you need to continuously challenging your body by increasing the stimulus that you give to the muscle, and that was going to keep them challenging and keep them stronger and bigger. Take home message: movement is medicine. Consistency is key. However, consistency is the key ingredient in maintaining daily function, restoring biophysiological decline experienced in midlife. Yeah. Move better, feel better, and be better. Movement is key. Thank you very much.
Awesome, awesome. Thank you so much, Fernando. Can we show our appreciation for Fernando? Very informative presentation. Fantastic. Thank you so much. Do we have any questions for our speakers? Please raise your virtual hand. It will be good for us to talk to them. They've been talking for a while, so let's hear from you, the audience. Any questions that you have regarding what has been shared today? So just raise your virtual hand, and then I'll ask you to unmute, and we'll take it from there. All right, thank you, Nuruddin. Go ahead.
Yes, thank you for that wonderful presentation of our two speakers. And the last speaker, I just want to ask a question because I'm confused on situations whereby some people will be measuring one's daily activity by time, by minute. Some, they will be giving us by kilometer. Which one is most important? Is it by kilometer or by timing? Thank you.
Okay, Mr. Nuruddin, am I pronouncing it well? Or Bello?
Yes, go ahead.
Okay. Now, you ask if measuring activity, is it best to do it by distance or by time? Is that correct? Is that what you?
Yes.
Oh, okay. Yeah. I mean, either way is fine. So it depends what you got available. So I mean, if you walk in, if you walk in usually for half an hour, so you're actually measuring your exercise intensity by mile or meters, for instance. Oh, sorry, by time. If you walk in miles, so if you do like 12 miles or 12 kilometer, that you're measuring your workout by kilometer. However, there's no much difference between those two because at the end of the day, at the end of the day, if you're walking 12 kilometer, you're gonna be walking within a certain time. So your 12 kilometer might cover it, might end up you might end up doing the 12 kilometer in maybe 10 minutes or 20 minutes. So time and the distance kind of similar in that sense. So either when you use a distance or time, it doesn't really matter. What matters is what you're feeling in your body while you're doing your exercises. And that's what's going to give you the proper measurement. So that's why I would prefer to use the rate of exertion, which is that diagram I show. So when you're walking for 12 kilometers, do you feel out of breath? Can you talk? Can you sing at that point? If you can, it means that you're not working hard enough. So you need to sort of increase that. If you can't sing or you can't talk, then yes, you're working hard enough. So time does not matter in that sense. So it's the distance that you cover that is actually your measurement at this point. Does that make sense?
Great, thank you. Chinyere, I think there was one you were going to respond from the chat.
Yeah, there are a couple of questions in the chat. So the question in response is asking about long COVID and exercise. So obviously the whole COVID kind of effect is something relatively new in kind of the research and the benefit of exercise. But one thing I would advise in terms of people having the symptoms of long COVID. And again, they can be quite varied. Sometimes it's like as mentioned by the person asking the question, the malaise or the fatigue, and also sometimes muscle aches or just feeling low in energy. So what I've noticed from the patients I've come across with long COVID, the key is on the days where you feel not too bad or feel well, try not to do too much on those days, because what sometimes happens is, say someone's feeling, oh, okay, I'm having quite a good day, then they do a lot of exercise and essentially um spike how much they do, and then they really pay for it for several days afterwards. So with the long COVID, especially in terms of exerting yourself, things like cardio are useful, but trying to avoid doing too much and rather doing small chunks to see how your body reacts the 24 hours afterwards. Some people with long COVID find benefit of doing things like swimming, whether in kind of water, especially in warmer water. It seems to help with the muscles and any fatigue. And some people find benefit of also doing light weights. So not necessarily kind of, trying to do like massive weights and leg press or bench press, but trying to do low level weights and even walking with small arm weights while they're walking or ankle weights can be helpful to just do something extra for the muscle strength. But I think the key is the malaise after exertion sometimes can be caused by doing too much when you may feel the symptoms aren't too bad. So the advice would be trying to pace yourself with any activity if you are having symptoms of long COVID. Um, I hope that is useful. And I think there was another question. Let me just try and find it. Yes, there was another question that was about recommendations for an 81-year-old with Alzheimer's disease. So for obviously that's kind of like a cognitive condition where, the actual effect on the person can be very varied. So depending on things like stability, memory, etc., those might be the limiting factors in terms of doing certain exercises. Obviously, I'm not saying go for a walk by yourself if there's a risk of getting lost, but certainly things in the house can still be done safely. Um, for older adults, so say even older, like 60 plus, the strength and balance element is incredibly important. So there are seated exercises that can be done, which are very helpful for strength. So it's very simple things when seated, kind of extending one leg after the other out and trying to hold it in the air to get your leg muscles working. Simple exercises, sit to stand. So with a supported chair, going up and down several times, say 10 reps up and down, and then resting, then doing it up and down again. You're using the chair as a support and pushing off from the chair to lift your weight and then going back down. And it's safer than trying to do something that involves balancing or walking because you've got the support of a chair. You're working your arms from the pushing off, and the chair is stable on the ground, so you have a support if anything happens. So that can be a good exercise for strength. Stretching, I would also recommend in terms of the flexibility. It's a safe exercise. You can do it on the floor and do gentle stretches, or you can do it while seated as well in terms of gentle stretches. And regarding finally the strengthening aspect, obviously the one I mentioned pushing up, but seated hand weights, even just cans of beans, chopped tomatoes, whatever, doing hand weights as well, because you want to still keep your upper body strength as good as possible. So biceps curls like this, and then also the overhead press. That can be a simple exercise to keep your upper body strong and functional without too much risk at all.
Fantastic. Thank you so much. Okay, before we take any more questions, I've just put a link in the chat for the feedback form. Please, could we start completing that? The speakers would love to hear your feedback and your thoughts, and would also like to know what other topics you would want us to cover in our future webinars. The form is very short, so please, 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 if you could fill that now when we're taking questions. Okay. Fernando, did you want to add anything about the exercise for the 81-year-old with Alzheimer's anymore?
Yeah, so with this one, the question was, please, what exercise will you recommend for an 81-year-old with Alzheimer's disease? Now, I'm not going to go to a particular exercise program for this person. However, what I'll suggest is to seek a professional advice, because as an 81-year-old, I need to, as a physiotherapy, I need to assess you in clinic and then see what you're able to do, and see your abilities before I can prescribe exercise. But in general term, you can actually engage into any exercise that you like. So from strengthening, cardio, flexibility, and balance, especially. Now, there are different type of exercises in those groups, and we also call something adaptation. So we can adapt any exercise to fit your strength and your capability. So to be honest with this person, 81-year-old person, I need an assessment to sort of give you a specific, which is going to be like a target, personalized exercise training program for this person. But in general, walking is fine. Carry on moving, walking, sit and stand, easy. And those are the things that you can do daily just to keep moving.
Fantastic. Okay. Any more questions? I've allowed you to unmute. If you have a question, please unmute and ask your question.
Praise God. Praise God. Well done.
Thank you.
Thank you. Please, can you talk about joint fitness? Joint tightness and swellings of the joints. I don't know if it's something, how exercise can help and what type of exercises can help. Thank you.
Yeah, so I mean, with joint swelling and tightness, so often with these things, it can be trying to work out what's causing it initially. So there can be actual underlying conditions that can, of course, cause joint swelling and tightness. So there's an element that, yes, and there's a need for investigation to check for things like rheumatoid arthritis, things with the heart, which can sometimes cause joint swelling. In general, if a joint kind of is acutely swollen, so just from a initial injury, obviously typically the advice is to try to elevate it, put ice on it, etc. However, if someone seems to recurrently notice that with standing through the day they slightly get ankle swelling or even the heat, these things often can happen. And I think the best advice with swelling, that's low level swelling, that's not anything serious, is obviously elevating the limb. So it's often ankles or knees, elevating it. There's also benefit of what we've mentioned in terms of stretching for the joint tightness. And this can be obviously different joints. The back tightness, sometimes people get, as I've said, related sometimes to sitting. Actually, some people feel a lot of tightness in their hamstring muscles, so the big muscles at the back of your upper leg, like around the thigh. So stretching can help, but I often try to say to people that when you stretch, it can feel uncomfortable, but it shouldn't be like sharp pain when you're stretching. So generally, if a joint is tight, stretching can be beneficial. But if there seems to be a underlying or recurring pattern, of course, the advice is to get it clinically checked to make sure there's not an underlying medical condition that is causing it to happen repeatedly.
Thank you for that, Chinyere. So there's someone just popped the question: what exercise is good for patients with severe, I assume that's a severe back pain? Professor Bello, do you want to unmute and expand on that? Is there more to that? You can unmute, Professor Bello. If not, we'll just take it as it is. Go on, Chinny.
What was the question?
What exercise is good for patients with severe back pain? I assume it's back pain. So anyone can take that.
Yes.
Okay.
Sorry, Fernando, go ahead.
So with a severe back pain, your first line of treatment will be to refer to your healthcare professional, like GP, for instance, and they might be able to refer you to the appropriate healthcare professional. So it depends what happened to you. Did you experience that back pain through a trauma or just a gradual So we need to know the cause, the underlying cause of that back pain before we can actually prescribe any treatment. So, but again, the evidence is clear. Any back pain that is non or idiopathic back pain, we can no afford to rest. We have to keep moving, and that's the key message for that. So moving, because doing like a stretch, for instance, gentle exercises, walking, swimming is very important for to keep your back pain under check.
Thank you, Thierry.
Yeah, and I was just going to say, I don't know, just to check, Flora, if I'm allowed, there's some exercise videos from the kind of, obviously in England, like the Chartered Physio Association, that can be quite good. I'm happy to share the link in the website, in the chat for reference, obviously as a support mechanism, but for people to have know kind of where they can go to for advice. As Fernando said, for kind of back pain, it's a very common presentation, but we always tell people if there's some kind of acute episode, so it comes on suddenly or certainly associated with trauma, that needs to be checked out. But the kind of more gradual one that someone might have, especially linked to sitting or they just feel it like when they're doing day-to-day activities. Often that's what we call mechanical back pain. And certainly avoiding moving is the worst thing you can do. Because when you avoid moving, the rest of your body starts moving in a strange way to adapt, and then you can start having pain in other areas. So broadly speaking, the advice for with back pain is to try to make sure that you keep it moving, and you also do gentle stretches to try to reduce your symptoms.
And the key of message, of course, is see your healthcare professional first. Everything we're discussing here is for educational purposes because your full history is not known. Okay, so this is just general information. Yeah, Chinyere, you can share that in the chat that for information. Before we take the next question, please do complete the feedback form. I can see there are over 50 people on the call. Only 4 people have completed the form. It's not very long, so please give us your feedback. Thank you so much. Next question, T-Mac, you want to unmute yourself and ask your question, or would you like us to take it as it is? Let's have some interaction from the audience. You can unmute yourself if you're still on. Let's see. Yeah. No? Okay. What's the best exercise and diet for someone who is menopausal, I assume, and is finding it very difficult to lose weight and carrying the majority weight in their belly?
Yeah. Yeah, so I mean, that can be something that a lot of women going through the menopause experience. First of all, weight gain and finding it harder to shift the weight. So oftentimes for weight loss or managing, essentially kind of burning the fat in the body, we do need to do fairly high levels of intensity in exercise, or the level of exercise that you used to be able to do to maintain your weight basically isn't sufficient. So I would recommend obviously the basic things like brisk walking, but sometimes focusing on the abdominal fat and toning the muscles around there can be important. So I would recommend core exercises, whether it's things like trying to do gentle sit-ups, maybe adapted if you've got any kind of mobility issues. Things like, if you know what I mean by when I say the kind of hamstring bridge, so lying on the ground and pulling in the tummy and the pelvic floor to try to strengthen up the muscles, and doing repetitive exercises. There are a couple I'll mention. Again, I'll post links to describe what I'm actually talking about, but it's trying to work on the abdominal muscles and the core strength to target the muscle strength, but also burning the fat in that area. Often it will be targeted by high intensity, more vigorous exercise. You might have heard of things like high intensity training, and that has been shown to be quite beneficial in terms of fat burning and also weight loss for people. Something I didn't mention when I talked about around the menopause. We know around the menopause, sometimes things like incontinence, so leaking during exercise can be more of a problem and can be a reason that women who maybe were exercising before stop, or are fearful about starting exercise. So again, thinking about pelvic floor exercises, there are lots of videos online that you can see in terms of what that means, but the pelvic floor essentially holds everything up and holds things together. And we know that it's important for good bowel function and also for good urinary function. And as we get older, especially if you've had children or if you around the menopause where you lose your estrogen, everything can become a bit more floppy. And so part of another exercise that is useful around the time of menopause and even from, in your 20s, 30s, is doing specifically targeted pelvic floor exercises so that your pelvic floor is used to some strain through it, so that when you get older, and you're trying to do activities, you don't leak or you don't kind of have problems with pain around the pelvic floor.
Thank you so much. Fantastic. Any other questions? I'm just posting in the chat the link for our previous webinar on Live Well, Chop Well. We did that earlier in the year. So we talked about eating well, and now we've just talked about exercising and moving well. Any other questions? You can just unmute and ask your question, please, before we let our speakers go. No? Okay. Thank you to everyone who's filling in the feedback form. How many have I got? 8. Quite a few more would be great. Thank you. Right. Any more questions? Any more questions? Going once? Twice? Anybody? Okay. Any comments for our speakers? If you want to make a comment or any contribution from any other healthcare professional that's online.
Well, just to add to that last question that Chinile has answered, just to sort of emphasize on the fact that when you talk about stomach fat, exercise to get rid of body fat, basically, I will kind of more emphasize on a holistic approach of weight management rather, because even exercise does not actually the percentage of weight loss that exercise trigger is not that great compared to combination of all the lifestyle modification. So eat well, eat less, and also reduce your diet or good diet, exercise, and your mental, your good sleep, hygiene, all that kind of contribute to weight loss. So exercise is probably the smallest percentage of weight loss program. So if you want to focus on exercise to lose weight only, that's not going to happen. And also spot reduction fat is just a concept that is your body does not understand that. So basically, oh, I just want to lose fat in my belly and I'm going to start doing core exercise only. That's not going to happen. You need to sort of get rid of the fat from your cardiovascular workout for that to sort of reflect in the whole body, not just a part of the body.
Thank you, Fernando. Any questions? Okay. Going twice? Did they say going thrice? I can't remember. All right, if there are no more questions, we'll leave it there for today. Once again, thank you so much to Dr. Chinyere and Fernando for agreeing to come and share their expertise with us today. Please, once again, let's show them some appreciation. Fantastic, fantastic. Thank you so much. And all that's left to say, fill in the feedback form, share the recording, and have a great weekend. Thank you, everybody. And make sure you move better. Make sure you move. Eat well.
Absolutely.
Well.
Absolutely.
Did someone want to say something?
Just wanted to appreciate you too. Thank you.
Oh, thank you so much, man.
Yeah.
Bless you.
Thank you, amen. Thank you, man.